Hello and welcome to the session on cancer. Today I have with me one of the global pioneers in precision surgery on cancer, Dr. Tewari. Welcome to the session. And it's 100 years of Hindustan Times, and in the last 100 years, when you talk about cancer, it's the treatment options now have made a huge difference. 100 years ago, it used to be a death sentence, but now cancer survival is going up. So how have things changed for people with cancer today, Dr. Tewari?
I think cancer used to be a death sentence maybe about 100 years ago. But things have evolved quite a bit in the last 25, 30 years. We have a better understanding of why cancer happens. We have a better treatment for treating a cancer which, when found early enough, we understand the biology of the cancer, we understand how cancer interacts with the rest of the body, and we have major victories in the cancer. While in last 15 years I have come third time, we have a lot to celebrate, but it's still, this is a battle we haven't yet won, and I'm not sure we are there to talk about celebration, but we are here to talk about strategy. So there are many things can be done, why cancer happens, what we can do to reduce, but the most important thing we can talk about is how to find it early. So yes, in last 100 years cancer has been made a dent, but story hasn't yet been over.
So we have some data from India which was published this year which said that 71% of deaths were in people in their 30 to 69 years age group, cancer deaths I'm talking about. So is cancer affecting younger people now as compared to maybe 30 years ago?
So cancer is, in sheer number, is getting greater because people are living longer. Second thing is that people used to have a problem because of the heart diseases and the lung diseases. Once we have won that battle, cancer has become in the forefront. Still, every year, about 18 million people get diagnosed with a cancer. 1 in 5 people you will be knowing will have a cancer of some kind of other. About 9 million of them, about 50% of them, we lose every year due to the cancer death. But there are many who are living. At this time, about 46 million people are living who have had cancer. They are either fighting it or they have beaten it up. That 46 million, just to put things in perspective, it's more than the population of entire Canada. So that many people are living. So the cancer battle is not all about finding cancer and beating the cancer, but how to make the cancer battle livable. What I mean is that the cancer people don't die just because of cancer, but the side effects and certain things they have to live with for next 20 years, that also is an issue. And so the survivorship in cancer is a very important topic, and we have to focus on that.
So do we have a better understanding today of cancer genesis? Is there anything we can do to prevent it? I mean, I know saying no to tobacco and vaccination, but if you could just elaborate on that?
There are things we have done to kind of make a dent on the cancer. One of them is very simple one, and every Indian knows about it. Smoking is one of a known reason why cancer can happen in the lungs, can happen in many other parts of the body, including the prostate. Tobacco in one form or the other. Dents which we have made in the papilloma virus discussion. So smoking, tobacco, vaccines, they definitely have an impact on beating this cancer. But there are certain things which we don't think about it, but may have an impact on the cancer. And even if it doesn't prevent cancer from happening, it prevents cancer from taking our lives. And that is our metabolic syndrome, that is our diet, that's our exercise habits, that's about diabetes, that's about the obesity. Because a diabetic body or a metabolic body is a little bit inflamed body. And an inflamed body, anything goes to the next level. Inflammation sometimes is our friend, but many times it's a friend with the cancer. So managing inflammation is a very important part of our strategy for fighting cancer. So this is something we should be focusing on. Diet, exercise, lifestyle changes, stress. Stress can have an impact on having cancer or not having a cancer, or if have a cancer, a different outcome about the cancer is very related to stress. Stress impacts the body hormones. Stress impacts our food habits. Stress in certain cancers like pancreas and prostate can actually form a network of interactions between the cancer cells and the nerves. So what is happening in our mind may ultimately boost up the cancer in becoming more aggressive. So yes, there is a lot can be done, but the journey has just about started now.
You mentioned stress, so I'm going to ask you a couple of obvious questions. One, when people have allergies, then your body's under stress as well. And these days I run into every second person has some allergy or the other. Does that play a role as well? Do we have any information about it?
There is a stress and there is a stress. Stress of an allergy, stress of a cough, stress of a minor problem is not that stress I'm talking about. I'm talking about a lingering stress of where the food will come tomorrow, lingering stress of certain things which are going in our mind. Certain societies have that issue. So we, as a human, as a living, will have to deal with this stress, but what I'm talking about is a lingering stress about which we cannot do anything. The cause persists, so we are recycling those thoughts back and again. So there is a way to either get the problem out or learn how to manage the stress, and that's what we say. You don't have a control on what hits you, but we do have a control on how we handle what hits us. So managing our mind, our body, coming from India, Deepak Chopra's callings may have an impact here.
What about air pollution? We live in Delhi, so that's something we suffer every day.
That's my way of handling the stress. I cannot do anything about it. So we have to control our surroundings. But the cancer journey, when I'm answering any questions or responding to you, Sanchita, I'm doing it from three perspectives. One perspective is of a surgeon who has been doing it for the last 20, 30 years. I have operated on maybe about over 10,000 patients. I have seen maybe about 25,000 patients with cancer. So as a surgeon, I have a very close interaction with the patient, with the cancer, so I have some understanding. But the second part of the answer comes from as in what you call a policymaker. I also have a role in a cancer hospital where I make certain decisions as to what to be done and what not to be done. But I have a control on only in my hospital, in my atmosphere. But there is a third level of interaction should come, and that Prime Minister Modi or someone else can do it. That is, we can bring up the question in front that the pollution is not good, diet needs to be looked into it, what exposures we are getting from in food, from the air, from water, that may have an impact on the cancer, but there are things which I can do. I can still get out and exercise, I can still get a good night's sleep, I can avoid certain foods. That's in our control, so everyone should do that while we bring up the discussion up in front of the policymakers, and that's what we should do.
So we should control the things we can. That's the message.
Yeah, I think we should control our actions, we should control our surroundings, we should control people around, and we should focus on our lifestyle.
So Doc, how did you decide to become a cancer surgeon? Do you remember the first life you saved? As a surgeon or otherwise?
Cancer surgeon discussion versus first life I saved was in two different discussions. I was in a medical school in Kanpur. I was in a second-year medical student. It was a weekend, and I was in a house in the first floor. And then suddenly there was just the neighboring house, there was a construction going on, and there was a small child, a baby, drowned in the water. You gave me the name. What is that?
The Hodi, the construction water well.
The construction water was being collected there, and then there was a baby who drowned in that water. And that taught me that the timing is everything about medicine. I happened to be there. I jumped onto that area, and somehow I managed to revive that few months old baby the mom had brought to the work because that's the only way they could do it. So that was my interaction with the life and what the timing in the medicine matters. About the cancer, I got involved with the prostate cancer about 25 years ago. This was not an easy cancer to fight. Many other times in cancer you talk about, did you take all the cancer out? That's an important goal. But in prostate cancer, it happens to be a very complicated organ that it is very close to the urinary system and it's very close to sexuality. So finding a fine balance between the nerve sparing and muscle sparing and then still getting all the cancer out, it was a complicated cancer to fight. And I thought if having left India and doing something, why not just do that.
So prostate cancer, since you mentioned it, globally it's the second most common cancer in men. But it's not talked about enough in India. The casing, I mean, and people getting older, cases are rising. Why is that? I mean, what is the barrier? Why aren't more people discussing it like breast cancer or lung cancer? What do we need to do to raise awareness?
So prostate is one of the most common men's cancer. And in India, it used to be number 11 about 10 years ago. And right now, amongst all cancers, all genders, it's number 3. And as Lancet is predicting, we may be heading towards a tsunami coming our way, in which the number of prostate cancer cases will double in next 10, 20 years. We don't talk about it because that's an organ we don't even know what it does. We don't talk about it because it's a delicate organ to talk about sexuality, and it is a very awkward place to locate it. And we don't talk about it because initially, first time when we found the cancer, it was usually in the bone or is in much more advanced stage. So there was no cure available, so we didn't even know that this patient is having the problem because of prostate cancer, because cancer was in the bone or cancer was in the lung, even though it started from prostate. But now the awareness is increasing, and the reason we are talking about it today, because this is going to be number 1 cancer even in India in next 10, 20 years. And the good news is it's 95% curable cancer. It's a cancer I have the most friends for last 20 years, 25 years. But it's a curable cancer if we find it in time. And that in time is the discussion about India, because in USA, if I find a prostate cancer, 90% of them, they are curable to start with. Here in India, the numbers are about 50-50. So the only difference is it only took 5 extra years for us to find a cancer in India than what we are doing in the United States, and that makes us handicapped. So if nothing else happens, this discussion about prostate cancer and changes the perspective about us, let's talk about it, I think that will have a major impact, and hopefully we will change the dynamics here also.
But in the US, PSA, prostate cancer screening is very routine. In India, it's still not. People have to ask for it. So what is your advice? When should people go in for screening? Like breast cancer screening now is part of your annual routine health checkup.
So before I answer the question about the PSA and when it should be done, I think I should also mention that the prostate cancer screening is not a standard screening, because sometimes it can cause alarms which are unnecessary. PSA can be high, not just because of cancer. PSA can be high because patient has a very enlarged prostate. PSA can be high because prostate is inflamed. PSA can be high because patient had some urinary issue or infection recently. So if every abnormal PSA is going to cause anxiety, if every abnormal PSA is going to cause a biopsy to be done, which is an invasive procedure, that may not be what I would like to convey. But having a PSA, starting at the age of maybe 45 years of age, is a good idea. Don't do it beyond 70 years of age based on the life expectancy, unless and until your father, who is 101-year-old, is telling you to go and get the PSA done, then yes, you can get it done even at old age. That means you have a life expectancy in your family. If someone has a family history of prostate cancer, what I mean is that brother had it, father had it, grandfather had it, ladies had some kind of a breast cancer, someone had a pancreatic cancer, that means that there is a cluster of a cancer growing around in the family, then we can start a little early. We can start at about maybe 40 years of age. But getting a PSA doesn't mean getting a biopsy. Getting a biopsy doesn't mean that everyone will have an aggressive cancer, because cancer can be relatively at different shades of cancer. And we can have that conversation, because not every patient with the prostate cancer we diagnose needs a treatment. Many of them can be watched, what we call an active monitoring. But there are the one who are sitting time bomb, and we need to find them and diffuse them before they have really clicked off. And that's the whole benefit about finding it early, because later on we win in months, early on we win in decades. So the victory, 30 decades, 20 decades, versus 3 months extra survival versus 6 months, just because we found it much later.
So are there any early signs that people should watch out for, or is it already too late by the time, symptoms are appearing?
Just like hypertension, prostate cancer is what we call a silent killer.
That's a very scary term when it comes to disease. The silent disease and silent killer.
So by the time cancer is curable, it will not produce any symptoms. It will not produce any symptom, even though the organ in which it is going to come will produce symptoms which we may get confused. So the same prostate which is developing cancer in 1 in 7 men, 1 in 8 men, has enlargement of the prostate which starts after 56 years of age, and patients may have to go again and again to urinate. Patient may have a difficulty in passing urine. Patient may have some pain and burning. Patients may have some infections and all those things. They come usually late because of cancer, but if someone is having those symptoms, getting it checked for prostate cancer itself is a good idea. But my message is, don't wait for a symptom to come in a prostate cancer journey. Get yourself checked before, because that's when it is curable. We can still win a fight, but the victory is not that well managed if we let the symptoms come in.
So you're recommending checking every year or every 2 years like breast cancer?
So if we start at about 45 and the PSA is below a certain number, then you don't have to do it next for 2 years. But if PSA is borderline, then you can come back in a year. If PSA is abnormal, then repeat it in 2 months. And if it still is abnormal, get an MRI imaging. There is a lot more being done on the biomarkers. PSA is one of the biomarkers. And maybe this is the time I may flip towards understanding the cancer a little bit more, because what is cancer? We have to reflect upon it. Cancer is our own cell. It's not something a virus has come inside our body or it is something outside. It is our own cell which somehow felt that their life is in danger. It may happen because they have some bad chemical around them. It may be there because air conditioning in that part of the area has some more pollution. It may happen because there is a more heated area in that area, or it may happen that a particular part of our body is not getting enough oxygen. So the cell in that neighborhood is feeling threatened. Our own cell didn't do anything wrong, but now is feeling that I am at verge of dying. When they are dying, we should also know that every given minute, about 1 million cells are being changed in our body, and about 1 trillion times there is a mutation in the body which happens every day. It is all controlled. So the combination of a cell feeling threatened, they start making certain changes in themselves to survive, to the point that they become super smart. Once they survive, they forget that one of the sole reasons for the existence is that we have to respect the social system, that in this room we can have maybe 5,000 people, but if there are 20,000 people in this room, in one corner of it, it will cause trouble. They don't know when to stop. So that is what's happening in the cancer cell because of some reason or other. It could be infection, it could be inflammation, it could be a virus, it could be a radiation, it could be a chemical. They somehow are at death risk and they have figured out how to not to die. But in that process of living, they have lived too well that they are now killing the irregular cells. And that's what the cancer journey is. And that's the reason we have to manage it in a more holistic way rather than just taking it out. And we do treat them out by surgically radiation or some other chemicals, but it's a complicated story.
So cancer is treatable, we know that, but still people are very scared of cancer treatment because of the side effects, because of, so you have come up with techniques for surgery which lower the risks of side effects after surgery. So could you just share that and tell us about it?
So let's talk about prostate cancer, because prostate cancer happens to be very close to certain nerves which are literally touching the organ, and these nerves are controlling the urinary control, and it's also controlling the sexual function and ejaculation and everything. And the difference between the cancer cell and these nerves are literally in millimeters. So I had to spend last 10, 20 years to understand the anatomy of those nerves a little bit better, use a robot to get me a magnification, develop certain methods of delicately dissecting it out, and still in not all the patients, in the right patients, in majority of them, we can get the function back if we find the cancer early. So yes, the quality of life discussion is an important discussion definitely in prostate, and developing a nerve-sparing procedure with a robot, with a delicacy, I think has been a winner, but the journey is not yet over. Still there are patients who don't get the function back.
So you're also using systemic therapy for treatment. So is that resulting in better outcomes?
So when the cancer, and let's continue the discussion on the prostate cancer, if you find it early, you have one option. If it is not very aggressive, you can watch it. So that's known as an active surveillance. Some patients have a cancer which is significant enough that they will cause trouble day after tomorrow or next month and next year. We remove them. There are some which are a little bit more aggressive, or the patient is older. We can give them radiation. But there are ones in whom the cancer is not only in prostate, but it's also in the lymph nodes, it's also in the bones, it's also in the lungs. These are the patients who benefit not just by the local removal of the mothership, but they also benefit from giving something which circulates in the body as in chemical. In prostate, there are hormones we give, there are chemotherapies we give, and they don't impact just the cancer cells. They impact the normal cells of the body also. So that's the reason the cost of curing or treating that cancer gets a little bit more annoying. But yes, we do give chemotherapies and hormones in that situation. Of late, we have leveraged our understanding of cancer to the next level of treatment. In order for cancer to become cancerous, it has to have some mutations. These mutations give them an edge that they can out-survive the normal cells. But that mutation can be targeted as a precision therapy that we can find in a special molecule which will only go and impact those people, those cells which have that mutation. And if we find that mutation and we deliver some medicine or a bomb just to those cells which have that mutation, it can have a little bit more precise treatment of that. So that's the field which is evolving. We call it theranostics, we call it targeted therapy, we call it dual targeted therapy. We have immunotherapies coming up and a lot of exciting things coming out right now, but it's better to find it when you can take care of it in a cleaner way than to resort to these more aggressive forms of treatments.
So technology has emerged as a great equalizer, not just for treatment of all cancers and also diagnosis of cancers. So are you at your institute using AI for prostate cancer?
I think this is serendipity. And year was 1996 when I wrote the first paper on AI and prostate cancer. And it took about 20 years before technology and the field got totally ready to fight on it. So we have a couple of different projects going on in AI. And I personally think AI could be a great equalizer. Think about, and there is no better place than India that it can be done. Cancer happens because of lifestyle. Cancer happens because of genes. Cancer happens because of what we eat. Cancer happens because what exposure comes to us. Cancer happens because of the radiation which is coming to us. Cancer happens because of the medications we are consuming. Cancer happens because of the food which is bringing chemicals. It's a multifaceted cancer journey which ultimately results in cancer. I go through the airport looking at my retinal scan. Out of 6 billion, 8 billion people in the world, it knows that it's me, and I just go through the security in 30 seconds. If I can collect all this information in about 1 million patients in next 2 years and trained an AI to predict which patient among this is in higher risk of developing A cancer versus the B cancer, triage them to the 3 categories: low risk, intermediate risk, high risk. Intermediate and high risk can be sent for the next level of screening. Low risk, go ahead and come back in about 2 years. Get this test done, get this test done, your weight is a little high. That, I think, is gonna happen. And a country where we have phone in everyone's hand, it's possible to implement this kind of a technology and develop it. And I personally believe that this is the best time for cancer treatment to evolve, because AI could be one of the best equalizer, and I personally believe the 1 million strong could be a project we can do, and India should be a launching pad for that.
I think I completely agree with you. I think India is a great place where we can actually do things at scale and deliver and reach results. So what makes Indians such great doctors? I mean, Indian doctors do well, so here, well, and then when they go abroad, they do very well. So what is it about Indians that, is associated with good medical care?
Say it again, what is about the Indians, why we get the cancer?
Why are Indians such great doctors? What makes, well, you a great doctor, or the doctors sitting here great doctors?
I think Indians, credit goes to the parents. The education and working hard and basic work ethics comes from the parents. I mean, I think generationally we have been hammered into it, that that's the way we are. But we also happen to have one extra tool possibly. It's only Indians who, if they find someone slipping on a floor on the road, they will stop and they will engage. We have empathy. I think we have more empathy than most other cultures. We want to get involved. And I think empathy within work ethics and possibly some luck, I think that may help us. So,
thank you so much, Dr. Tewari. It was a pleasure talking to you as usual. Thank you. Thank you so much.